I want to make a point of clarification, or should that be correction and explanation. My attention was drawn yesterday to a range of social media posts which attacked me. Now, I don't normally worry about this stuff, and rest assured I'm not worried now, but I worry about our viewers and our listeners. I opened my radio program yesterday by saying that our job in the media is, amongst other things, to inform, advise, and certainly not alarm. The fact that people are fighting over toilet paper in supermarkets indicates a deep sense of alarm and panic. Now, I must say, I think the media have played a major role in promoting this alarm by the way in which this pandemic has been treated. And that alarm has led to people seeking resources, either in hospitals or supermarkets, that should be better used for those at risk. I quoted yesterday the Prime Minister, who made the point on Sunday, and I support it, that, quote, for the vast majority, around 8 in 10 is our advice, it'll be a mild illness and it will pass. I repeated what the Prime Minister had said, quote, however, for older Australians and those who are more vulnerable, particularly those in remote communities and those with pre-existing health conditions, it is a far more serious virus, and that is our concern, he said. Our aim in all of this is to protect the most vulnerable, the most at risk. That's what I was arguing all yesterday morning, and we'll argue tonight. And I cited a Harvard University academic, an instructor at the Harvard Medical School. I've written about it today in Sydney's Daily Telegraph newspaper. And supporting Dr. Faust, I wrote, as he argued, that the mortality rate is 0 for children 10 or younger, and 0.2% to 0.4% in most healthy, non-geriatric adults. I cited Dr. Faust's argument that we need to stop worrying about the virus spreading amongst healthy people and commit most, if not all, of our resources to protect those truly at risk of developing critical illness and even death, everyone over 70, and people who are already at higher risk from this kind of virus. Dr. Faust argued, and I presented these arguments, that this leads to a few important conclusions. Focus on the right people and the right places. Focus on nursing homes, not schools and universities. On hospitals, not aeroplanes and football stadia. I argued, as did Dr. Faust, that we should not be squandering precious and limited resources. I said many times we should be looking after the elderly. Part of that involves alerting them to the fact that they are most at risk. I'm in that demographic. But while anyone's death diminishes us, as I spoke yesterday and tonight, there were 5 deaths. Or put another way, in 151 countries, excluding China, Italy, Iran, South Korea and Spain, the death total is 356. I don't think it's I who is frightening people. It's the headlines which suggest people are going to die if they contract the virus. The figures suggest otherwise. 9 million people die in China every year. 20 to 25,000 die every single day. I said all last week that the Prime Minister, the Health Minister and the Chief Medical Officers have done well. 5 deaths. I'm not dealing in exaggeration and alarmism, but I'm equally not certain that the economic burden that is being imposed is justified by the statistics. Some of the social media comments lead me to believe that if people are listening to what I said, they weren't listening carefully. The elderly and the vulnerable, and those with poor immune systems, and those already carrying a precondition, they're the ones that need all our attention and help. Charging into supermarkets and stockpiling and demanding that every Tom, Dick and Harry be tested is hardly channeling resources to where they're needed. Peter Dutton and Richard Wilkins have proved the accuracy of the Prime Minister's comments. For the vast majority, around 8 in 10 is our advice, it'll be a mild illness and it will pass.